was a professional baseball player suffering from depression and medications weren't helping. And my sadness became so overwhelming that I attempted suicide. After my incident, I started seeing a psychiatrist weekly. I think I eventually went through 6 different medications with 5 combinations. Even if I was feeling a little bit of a benefit from the actual medication, the side effects outweighed those benefits. After talking to Dr. Zand about NeuroStar TMS, I felt hopeful for the first time in a while, just because it made so much sense. I remember thinking, why wasn't this added to the description of my possible recovery process from the hospital? Why wasn't it, this is what we're starting you on with this medication, but if this doesn't work, there's also these other options, and this is one of them, because it is so beneficial for people like me. Perfect candidate of trying medication doesn't work, dealing with some serious negativity, depression, pessimism.
I first heard about Drew from the team psychologist of the San Francisco Giants. She told me they had a player who attempted suicide and was in the hospital awaiting discharge, but needed psychiatric care. Drew and I began to meet weekly for therapy. We tried many medications over the years. Some of them had minor benefits, but for the most part he had side effects and we weren't seeing the improvement we were looking for. After relapsing back into a deep depressive episode, we decided that NeuroStar would be a good option for Drew.
I believe in the science and I believe in the data, so I just decided to go for it with NeuroStar. NeuroStar gave me a new possibility for treating my depression. After 3 weeks, I think is when I really noticed a difference in my energy levels, which inevitably allowed me to reframe some of these negative thoughts, which led to just a more overall positive outlook on life. And I remember that specific day I was getting ready to have a coffee before a longer meeting after my treatment process early that morning. And I remember stopping myself at the coffee machine like, I actually feel pretty energized right now. Maybe I can hold off on this coffee. And then went in to the meeting and actually partook a little bit more in the meeting. And that's when the excitement really started to kind of kick off for me. Dr. Zand was very supportive and he really helped me get to the finish line with my treatment process. And now that I'm finished with my treatments, I feel so much better. I feel so much more energized, and I feel like I have this huge weight lifted off my chest.
The cycle of medications can be very disheartening for patients. Going through trials of no efficacy, side effects, can make patients not want to try medications anymore. But if they know there's another option, if medication hasn't worked for them, they might have more hope and optimism in their future. Overall, I think it's very important that patients be presented with all their treatment options early on, so they know that there are possibilities for relief from depression. I chose this profession to help as many people as I can. We all have a mental health journey, some more challenging than others, and I'm grateful that for those where medication doesn't help, they have the option for NeuroStar TMS.
I'm really grateful that Dr. Zand recognized that I was such a good candidate for this treatment. I really wish people who are on medication that aren't seeing the benefits that they're looking for really knew more about NeuroStar, because it's such a great option and it's so beneficial, and it's something that I really wish would have been brought to my attention sooner.